Good morning, students. So we'll continue with the class. So in today's topic, in today's class, I'll be dealing with cirrhosis of liver. So what is the cirrhosis of liver? So cirrhosis liver, it is a chronic degenerative disease. Okay, cirrhosis of liver, it is usually a chronic degenerative disease in which normal liver cell, in which normal liver cells are damaged. Okay, in which normal liver cells are damaged and are then replaced by fibrous tissues. Okay, are then replaced by fibrous tissue. So what is cirrhosis of liver? So cirrhosis of liver, it is usually a degenerative disease in which normal liver cells are replaced by fibrous tissues. Okay, normal liver cells are damaged and then it is replaced by fibrous tissue. So what is this? So cirrhosis of liver, it is usually a degenerative disease. Okay, it is usually a degenerative disease in which normal liver cells are damaged. Okay, in which normal liver cells are damaged and then it is replaced by fibrous tissues. Okay, it is replaced by fibrous tissue. So this scar tissue, okay, this fibrous tissue, it is nothing but scar tissue. This replaces the healthy liver cells. Okay, it replaces the healthy liver cells partially. Okay, it usually replaces the healthy liver partially, blocking the flow of blood through the liver. Okay, so this scar tissue, it usually replaces the healthy liver, blocking the blood supply to the liver. Okay, blocking the blood supply through the blocking the flow of blood through the liver. Okay, blocking the flow of blood through the liver. So therefore, due to this, the liver is unable to function properly. Due to this, liver is unable to function properly and then it leads to liver failure. Okay, then it leads to liver failure. So what is this? In this mainly like cirrhosis of liver, it is usually a degenerative disease in which the normal liver cells are damaged and then it is replaced by fibrous tissue, and the scar tissue usually replaces the healthy liver tissue, partially blocking the flow of blood to the liver, which results in liver failure. Okay, which usually results in liver failure. So that is usually the definition of the cirrhosis of liver. So this is classification of cirrhosis of liver. They are mainly classified into three: alcoholic cirrhosis, post-necrotic cirrhosis and biliary cirrhosis. Okay, it is usually classified into three: alcoholic cirrhosis, post-necrotic cirrhosis and biliary cirrhosis. So what is this alcoholic cirrhosis? So alcoholic cirrhosis, it is also known as larynx cirrhosis. Okay, it is also known as larynx cirrhosis. It is usually the commonest type. Okay, it is usually the commonest type and it is mainly caused by hepatitis C virus. Okay, it is mainly caused by hepatitis C and chronic alcoholic use. So alcoholic cirrhosis, it is also called as larynx disease. Okay, it is also called as larynx cirrhosis and this is the most common type of cirrhosis of liver. Okay, it is the most common type of cirrhosis of liver. So this usually it is caused by hepatitis C and continuous alcohol use. Okay, and continuous alcoholic use. So this damage, okay, so the damage usually leads to malnutrition and malnutrition. Okay, so it is usually leads to malnutrition. Okay, the damage usually leads to malnutrition. So that is alcoholic cirrhosis. This is also called as larynx disease and is the commonest type of cirrhosis of liver. So here it is mainly caused by hepatitis C and continuous alcohol use and the damage leads to malnutrition. So next is post-necrotic cirrhosis. So in case of this post-necrotic cirrhosis, it accounts for about 10 to 30% of the individuals are affected by this post-necrotic cirrhosis. About 10 to 30% of the people are affected by this post-necrotic cirrhosis. So this is usually caused by toxic agents. Okay, it is usually caused by toxic agents or viral hepatitis. Okay, it is usually caused by toxic agents or by viral hepatitis. Okay, or by viral hepatitis. So that is usually what happens. So here mainly they usually see that they will be having necrosis of liver. Okay, they will be having necrosis of liver cells, and this is that is usually seen in case of post-necrotic cirrhosis of cirrhosis. So post-necrotic cirrhosis, it usually affects about 10 to 30% of the patients. So here it is mainly caused by toxic agents or due to viral hepatitis. So in this it is seen that there will be necrosis of the liver cells. Okay, there will be necrosis of the liver cells. So that is post-necrotic cirrhosis. So next is biliary cirrhosis. So biliary cirrhosis, it is usually a chronic disease and the cause is that the bile duct in the liver, okay, the bile duct in the liver becomes inflamed and damaged by scar, okay, tissue. Okay, so that is the bile duct in the liver gets inflamed and damaged. The bile duct in the liver gets inflamed and damaged. So that is usually what happens, because the fibrous tissue or the scar tissue will be formed around the biliary tract. Okay, it will be found around the biliary tract. Okay, it is found around the biliary tract or around the bile ducts. Okay, around the bile ducts. So that usually causes this biliary cirrhosis. So therefore, there is obstruction in the bile duct and infection of the bile duct. There is obstruction in the bile duct as well as infection in the bile duct. So that is biliary cirrhosis. So this occurs when there is bile duct in the liver gets inflamed and damaged. This is occurring because the scar or fibrous tissue gets attached. Okay, the scar or fibrous tissue attaches around the biliary duct. Okay, it gets attached around the biliary duct. So this causes obstruction and normally there are three types of cirrhosis: alcoholic cirrhosis, post-necrotic cirrhosis as well as biliary cirrhosis. So alcoholic cirrhosis, it is also called as larynx cirrhosis, and it is the common type, and it is primarily caused by hepatitis C and chronic alcoholic consumption. And then post-necrotic cirrhosis, it is usually seen in case of it is mainly seen in 10 to 30% of the patients where necrosis of the liver cells occurs, and this is mainly caused by viral hepatitis or due to any consumption of any toxic agents. Then biliary cirrhosis, it is mainly occurring due to scar tissue or fibrous tissues which is formed around the biliary duct, and which usually causes obstruction in the bile duct as well as usually causes obstruction in the bile duct, or it might be causing obstruction, or it might cause infection of the bile duct. So that is usually seen. So next is causes of this cirrhosis of liver. So what are the causes of the cirrhosis of liver? It is usually seen is that it might be due to the consumption of alcohol. Okay, it might be due to long-term consumption of alcohol, or it might be due to chronic hepatitis chronic hepatitis such as type B, C and D. Okay, it might be due to chronic hepatitis, that is might be due to B, C and D. That is usually there. And next it might be due to cystic fibrosis, and then it might be due to chronic congestive heart failure. Okay, it might be due to chronic congestive heart failure. And then in case of non-alcoholic, like in case of fatty liver, okay, in case of fatty liver disease, okay, in case of fatty liver disease, or in case of biliary atresia, okay, in case of biliary atresia, or in case of gallbladder surgery, okay, biliary atresia is a congenital disorder. And then in case of gallbladder surgery, okay, if there is any gallbladder surgery, so that time also it can occur. And then in case of glycogen storage disease, okay, in case of glycogen storage disease. So that is usually seen in case of causes of the cirrhosis of liver. So what are the causes? Long-term alcohol consumption, hepatitis, chronic hepatitis like B, C and D. And then in case of fatty liver, biliary atresia, gallbladder surgery, or in case of glycogen storage disease, or in case of cystic fibrosis. Okay, these are usually the causes of this cirrhosis of liver. So next is pathophysiology. So what is this pathophysiology? That is mainly in that it might be due to etiological factors. So etiological factors, I have already told that it might be to long-term consumption of alcohol, chronic viral hepatitis, cystic fibrosis, congestive heart failure, non-alcoholic fatty liver disease, biliary atresia, gallbladder surgery, glycogen storage disease. So this might be due to any etiological factors. Okay, it can be due to any etiological factors. So due to these etiological factors, what is happening? There will be diffuse destruction and regeneration of liver cells. Okay, there will be diffuse destruction and regeneration of liver cells. Okay, that is due to etiological factors. Diffuse destruction and regeneration of liver cells occurs. So due to this, there is formation of fibrous tissue. So once there is formation of fibrous tissues, it starts destroying liver cells. Okay, it starts destroying liver cells. Once the liver cells is destroyed, it is replaced by scar tissues. Okay, it is replaced by scar tissues as necrotic tissues develop. Okay, so due to this replacement, necrotic tissue develops. It leads to fibrosis. Cirrhosis damages the liver tissue. Okay, cirrhosis damages the liver tissue. So due to this, there is obstruction in blood, lymph and bile flow. Okay, due to this, there is obstruction in blood, lymph and bile flow that leads to hepatic insufficiency. So that is, it might be due to any etiological factors. Okay, it can be due to any etiological factors. Then there will be diffuse destruction and regeneration of liver cells. Okay, there might be diffuse destruction and regeneration of liver cells. So due to this, there is formation of fibrous tissue. Okay, due to this, there is formation of fibrous tissue, and that usually leads to destroyed liver cells, they are replaced gradually by scar tissues, and then necrotic tissues yield fibrosis, cirrhosis damage liver tissue, then there is obstruction in the blood, lymph and bile flow. This leads to hepatic insufficiency. Okay, this leads to hepatic insufficiency. So this is about this pathophysiology of cirrhosis of liver. So next is symptoms of this cirrhosis of liver. So they are mainly early stages, as it is divided into early stage and later stages. So in case of early stages, the symptoms that we can see, it is loss of appetite, weight loss, enlarged liver, ankle edema, vitamin deficiency will be there, nausea and vomiting will be there. In few cases we can see mild fever will be there, the abdominal pain, lack of energy, anemia will be there. So in the early stages, the symptoms that we can see, it is mainly like they will be having loss of appetite, weight loss, enlarged liver, vitamin deficiency, ankle edema, nausea and vomiting, mild fever, and then there will be lack of energy and anemia. Okay, so in the early stages, the symptoms that we can see, it is loss of appetite, weight loss. It might be loss of appetite, weight loss, enlarged liver, vitamin deficiency, nausea and vomiting, mild fever, ankle edema, loss of energy, as well as anemia. And the later on stages, okay, the disease becomes severe or something. So in that stages, we can see the diseases like the symptoms. It might be like ascites, gallstone formation will be there. Then frequent like indigestion occurs more. Okay, that is indigestion occurs more. Jaundice develops. Okay, they will be having jaundice, and then abdominal pain will be there. Esophageal varices develop. Okay, esophageal varices develop. Menstrual irregularities can be seen in the females. Then mental disturbances will be there. Hepatic encephalopathy will be there, and also there will be dark colored urine and poor concentration. So it is usually is that like in the later on stages, the symptoms that we can see, it is mainly ascites, gallstone formation will be there, indigestion, hepatic encephalopathy, poor concentration, dark colored urine, menstrual irregularities will be there, jaundice, esophageal varices and abdominal pain. So these are the symptoms which is usually present in the cirrhosis of liver. So it might be like early stages and later stages. In the early stages, there will be mild fever, lack of energy, anemia, abdominal pain, nausea, vomiting, loss of appetite, weight loss, enlarged liver, ankle edema. So these are the early symptoms that will be seen. And the later on symptoms, you can see menstrual irregularities, dark colored urine, hepatic encephalopathy, poor concentration, jaundice, abdominal pain, esophageal varices, and then gallstones, indigestion, ascites. So these are usually the later on stages that we can see. Usually the symptoms that is usually seen in case of cirrhosis of liver. So next is diagnosis. So what are the diagnosis? How it can be done? Mainly physical examination and history collection, CT scan, ultrasound, MRI scan, and then percutaneous transhepatic cholangiography, and then liver biopsy. So the diagnosis that we can go, it is that mainly by physical examination and history collection. Then it is usually by like CT scan, MRI scan, liver biopsy, transhepatic cholangiography, percutaneous transhepatic cholangiography, ultrasound. So these are usually by which we can go for diagnosing the cirrhosis of liver. So next is management. So normally the goal of this management is to reduce the scar tissue development. Okay, to reduce the scar tissue development around the liver. Okay, to reduce the scar tissue development around the liver. So what are the things that we have to do is that hospitalization is required. Okay, hospitalization is required when complication develops. Okay, hospitalization are required when complication is developed. Other than we can go with this treatment. So it is mainly we have to go with eating nutritious food. Okay, we have to ask the person to eat nutritious food, because malnutrition is the malnutrition can occur in cirrhosis of liver. So therefore they have to go eat nutritious food. So that is usually that. Then when like cirrhosis, if it is caused due to alcohol consumption, if the cirrhosis is caused due to alcohol consumption, then we have to ask the person to completely stop the intake of alcohol. Okay, we have to completely ask them to stop the intake of alcohol. So it is usually there. And in case of if it is due to viral hepatitis, okay, if it is due to a viral hepatitis, then antiviral drugs can be given. Okay, like antiviral drugs can be given. So next it is that, and in case of if ascites is developed, okay, if ascites is developed, then we have to go with giving them diuretics. Okay, if ascites developed, then we have to go with treating them with diuretics. So that is usually then, that is spironolactone. Okay, it is usually spironolactone is given. Okay, spironolactone is given. So this reduces the edema also as well as ascites also. It reduces the edema also as well as ascites. So that is, in case of if there is ascites and edema, then we have to go with giving them potassium sparing and diuretics should be given. Okay, potassium sparing, diuretics should be given. So this reduces both this. The like drug of choice it is spironolactone. Okay, spironolactone. Then oral antibiotics can be given. This is mainly to prevent infection. Okay, it is mainly to prevent infection. So that is usually because if there is severe infection along with ascites, then IV antibiotics is given. If there is severe infection along with ascites, then IV antibiotics is given through IV. Or else if ascites infection is not so severe, then oral antibiotics can be given. So that is usually about this thing. Then laxatives can be given if they have constipation. So that is usually to be given. And then in case of esophageal varices, okay, if there is esophageal varices, bleeding occurs, so in that case vasopressin can be used. Okay, in that case vasopressin can be used. And in case of portal hypertension, they can give this beta blockers. Okay, if there is portal hypertension, then they can give this beta blockers. And if at all if there is any severe severe liver failure, then liver transplantation can be done. So this is about this management of cirrhosis of liver. So mainly the goal of management is mainly to stop the development of scar tissue around the liver. Hospitalization is required if complication develops. So or else we can go with this management, that is giving them nutritious food, then asking them to stop alcohol completely. Then we can give them potassium sparing diuretics can be given to reduce edema and ascites. Antibiotics can be prescribed orally, and if infection is more, then we have to give IV antibiotics. And we have to go them giving them like beta blockers can be given if portal hypertension is then. Vasopressin can be given if they bleed due to esophageal varices, or if liver is completely damaged, then we have to go with liver transplantation. So that is usually about the cirrhosis of liver. So cirrhosis of liver is nothing but where there is development, the normal cells are damaged and it is replaced by scar tissue. It is usually a degenerative disease. Okay, it is usually a degenerative disease. So this is about this cirrhosis of liver. Topic that we will continue, it is portal hypertension. So what is portal hypertension? So portal hypertension is defined as portal pressure gradient as of about 12 mmHg or greater. Okay, or greater. It is often associated with ascites and varices. Okay, it is often associated with ascites and varices. So that is portal hypertension. It is usually defined as portal pressure gradient of about 12 mmHg or greater. So this is often associated with ascites and varices. So what is this portal hypertension? So portal hypertension, it is usually defined as portal pressure. Okay, portal hypertension, it is usually defined as portal pressure gradient of about 12 mmHg. Okay, portal pressure gradient of about 12 mmHg or greater, and it is often associated with ascites and varices. Okay, it is often associated with ascites and varices. So what is this portal hypertension? It is defined as portal pressure gradient of about 12 mmHg or greater. It is often associated with varices and ascites. So next is causes of portal hypertension. So what are the causes? Causes, it might be divided as pre-hepatic causes, hepatic causes and post-hepatic causes. So causes, it is divided into pre-hepatic causes, hepatic causes and post-hepatic causes. So what is this pre-hepatic causes? So pre-hepatic causes, it might be like it can be like congenital atresia, or it might be due to thrombosis of portal vein, or it might be due to compression by any tumor, or in case of splenomegaly. Okay, pre-hepatic causes, it can be like splenomegaly, compression by tumor, congenital atresia, or thrombosis of portal vein. So this is about this pre-hepatic causes. So pre-hepatic causes, it can be congenital atresia, thrombosis of portal vein, compression by tumor, or in case of splenomegaly. So hepatic causes, it can be like hepatic cirrhosis, acute alcohol liver disease, or in case of congenital hepatic fibrosis, primary biliary cirrhosis. So that is, it might be like due to hepatic cirrhosis, alcoholic liver disease, biliary cirrhosis, as well as hepatic fibrosis. So this is about this hepatic causes. Post-hepatic causes, it can be like in case of pericarditis and right heart failure. It can be due to pericarditis or right heart failure. So these are usually the causes of portal hypertension. So what is portal hypertension? Portal hypertension, hypertension is defined as portal pressure It is defined as portal pressure gradient of about 12 mm Hg operator. This is always caused, like this usually often associated with ascites and varices. So causes, it is divided into three: prehepatic, hepatic as well as post-hepatic causes. Prehepatic causes, it can be due to splenomegaly, compression by tumor, thrombosis of portal vein, or it might be due to congenital atresia. Hepatic causes, it might be liver cirrhosis, alcoholic liver disease, liver fibrosis as well as biliary cirrhosis. Next is hepatic causes, it can be due to pericarditis or right heart failure. So next is clinical manifestation. So what are the symptoms that you can see in case of this portal hypertension? It is that they will be having abdominal pain, severe abdominal pain will be there, GI bleeding will be there, then varicose veins of the esophagus. Okay, so that is GI bleeding, varicose veins of the esophagus, abdominal pain, stools will be like melena will be there, that is black colored stools. Okay, that is, or blood in the stools can be seen, that is melena will be there, and then they will be having ascites. Okay, they will be having ascites, hematemesis will be there. Hematemesis, it is nothing but blood in the vomiting. Platelets percentage reduces. Okay, platelets percentage reduces. Jaundice will be there, and then usually fatigue, and then altered sleeping pattern. Okay, altered sleeping pattern, weight loss will be there. So in case of this clinical symptoms, the symptoms that we can see, it is that abdominal pain will be there, abdominal pain will be there, GI bleeding will be there, varicose veins of the esophagus will be there, melena will be there, it is dark colored stools or blood in the stools, hematemesis will be there, blood in the vomiting, jaundice, ascites, altered sleeping pattern, weight loss, itching will be present. So these are the symptoms that is associated with portal hypertension. So in a diagnosis, how we will do? So diagnosis, it is mainly is that there is no simple test that will show that the person is having portal hypertension. It is mainly diagnosed with based on the ascites. Okay, it is mainly diagnosed based on the ascites or based on the varices, esophageal varices, that is done through physical examination. Other laboratory tests that we can do, it is a liver function test can be done, clotting test can be done, X-rays can be done, endoscopy should be done, biopsy will be done, then CT scan is done, MRI scan is done, abdominal ultrasound. So that is diagnosis, it is mainly done, like there is no specific test that we have to do that will confirm that the person is having portal hypertension. It is mainly diagnosed based on ascites. Okay, it is mainly diagnosed based on ascites. Other than that, we go with blood test, liver function test is done, X-ray, CT scan, abdominal scan, MRI scan, liver biopsy. So that is all this thing, it is usually done in order to diagnose this portal hypertension. So what are the management that we go? So treatment mainly depends upon the preventing the complications. Okay, treatment mainly depends on preventing the complications and also reducing the bleeding from the varices, that is reducing the bleeding from the varices. So what are the medication that we have to go? Is that we go with endoscopic therapy, medication, lifestyle changes. Okay, so that is we go with mainly endoscopic therapy, medications and lifestyle changes. So in case of this endoscopic therapy, okay, in case of this endoscopic therapy, so mainly it is that we go with banding or sclerotherapy. Okay, so in this endoscopic therapy we go with banding or sclerotherapy. Okay, it is mainly done like banding or sclerotherapy. So that is usually a procedure. Okay, banding, it is usually a procedure where it uses rubber band. Okay, where it usually rubber band and blocks it, rubber bands to block the blood vessels, because varices is there, right? So in case of varices only we go with this banding and sclerotherapy. So in this banding what we do is that, so in this mainly we use a rubber band to block the blood flow, okay, to block the blood vessels. So that is usually that. And in case of sclerotherapy, when the banding cannot be used, again when banding cannot be used, in that case we go with the sclerotherapy. So in the sclerosant solution, okay, in the sclerosant solution, that is ethanolamine oleate, okay, in the sclerosant solution, that is ethylamine oleate, it is injected in the bleeding varices so that it can cause scan. Okay, so that it can cause scan or it can reduce. So that is usually about this endoscopy therapy. In this endoscopy therapy, this is mainly used to reduce varices or bleeding from the varices. So that is mainly we go with banding or sclerotherapy. Banding, it is used where gastroenterologists will use rubber band to block the blood vessel. And in case of sclerotherapy, this is used only when banding cannot be used. So in this mainly a sclerosant solution, that is ethanolamine oleate will be used, and it is usually used injected in the bleeding varices to stop the bleeding, as that is usually done. So medications, mainly we go with beta blockers. Okay, medication we go with mainly beta blockers, that is propranolol. Okay, that is medication mainly we go with beta blockers, that is propranolol will be given. Lifestyle changes, that is good nutritional habits should be done. Okay, good nutritional habits should be done. Healthy food should be used. They should not use alcohol. Street food should be avoided. And then they should not use these herbal medications or over-the-counter drugs should be avoided. Then they have to follow a dietary management, and low sodium diet has to be taken. Okay, low sodium diet has to be taken. So that is usually about this management. So management mainly we go with endoscopy therapy, medications and lifestyle changes. So that is usually about this thing. This is about this management of this portal hypertension. When this fails, that is endoscopy therapy, dietary changes and medication, if this fail, then we go with other treatment, that is transjugular intrahepatic portosystemic shunt. Okay, transjugular intrahepatic portosystemic shunt. So this procedure name only suggests that they will be placing a shunt. Okay, they will be placing a shunt in the middle of the liver. Okay, they will be placing a shunt in the middle of the liver. This shunt connects the hepatic vein with the portal. So that is when endoscopic therapy, dietary changes, lifestyle changes and medication, if it doesn't work, then we go with the other treatment, that is transjugular intrahepatic portosystemic shunt. This shunt is placed in the middle of the liver, where it connects the hepatic vein with the portal vein. Okay, where it connects with the hepatic vein with the portal vein. So that is usually done. And then in the next procedure that we do, it is devascularization. It is a surgical procedure where it removes the bleeding varices. Okay, it is a surgical procedure where it removes the bleeding varices. So here also surgical shunt, it is like it is placed, but it will not control the bleeding. So that is usually about this thing. Since this paracentesis will be done, like the abdominal fluid will be removed. Okay, the excess abdominal fluid will be removed, that is ascites. So that will be removed. And in case end stage it is that liver transplantation will be done. Okay, in end stage it is that liver transplantation will be done. So these are the procedure which is done when the above, like endoscopic therapy, medications and lifestyle changes fails to correct this portal hypertension. Then we go with this treatment, that is intrajugular hepatic portosystemic shunt, and then we go with devascularization, and then we go with paracentesis and liver transplantation. So this is about this portal hypertension. So portal hypertension is nothing but where portal pressure gradient of about 12 mmHg or greater. It is seen in case of varices and ascites.